Wounds are a serious health complication that impact the quality of life for the individual and have significant clinical and economic implications. Chronic wounds can create additional challenges for patients who have compromised health status. Lack of appropriate and timely care leads to irreversible complications. In many cases, hard-to-heal chronic wounds can be avoided or, if detected in the early stages, managed effectively, reducing the risk of complications that lead to adverse health outcomes, hospitalization, and even death. Since the COVID-19 pandemic began, healthcare professionals have seen a rapid rise in acute and hard-to-heal wounds across all healthcare sectors. Evidence-based solutions exist to improve patient care, reduce hospitalizations, and lower spending on wounds. As an organization, we at Wounds Canada are excited to partner with Health Espresso to offer a digital health solution to support frontline clinicians, patients, policymakers, and researchers. This easy-to-use mobile and web-based integrative digital solution will provide an interprofessional health record to capture historical context, wound size, and healing progression, as well as patient at-home monitoring features to track progress and facilitate information sharing. Part of this solution will support the delivery of just-in-time learning features to increase the skills and knowledge of frontline clinicians. The remote patient monitoring is a key feature that will allow early identification of non-healing wounds. By leveraging the technology, we offer solutions that can improve patient health outcomes as well as save healthcare dollars. This technology will also provide us as a national organization to establish a Canadian national registry that can inform further research work in this area.
Treat the patient, see the whole person, not just the wound. This statement has resonated with me since I started working in my first nursing home in inner city Toronto more than a decade ago. At that time, I was treating Joe, a 75-year-old gentleman that lived in the nursing home. Joe had a large wound on his right shin, approximately 20 centimeters long. It was odorous and had large amounts of discharge. As a new doctor, I could not understand why this wound had not healed for months. Joe was thin, was not on any medications, and his recent blood work was normal. What was I missing? As I explored more of Joe's history, I discovered he had lived most of the last 20 years on the local street surrounding his current nursing home. He only returned to sleep at the home, and Joe hated regular showers. Over the last 2 years, he was having paranoid thoughts. He was afraid the nurses were intentionally making his wound worse. Joe was becoming more and more resistant to care for his wound. Since then, my family practice has focused on providing care to the most high-needs patients in our communities, the frail elderly, new immigrants and refugees, and persons living with limited housing and food security. The complete picture of our patients is seldom shared, especially when they are complex or have care from multiple partners. They are patients of the community, the hospital, and home care. As a family physician, I can share so many stories similar to Joe's. These stories are the inspiration for my role as the Chief Medical Officer of Health Espresso. As a member of this team, we have tried to develop a complete digital health record for our patients from birth to end of life. The Digital Patient Profile, or DPP, is a complete digital blueprint of the patient's overall health and history. More importantly, Health Espresso's Digital Patient Profile shares real-time images, information, and progress records for timely decision-making. In summary, Joe would have collaborative, efficient, and practical care if his health information was shared. Imagine if we had been able to upload great quality images and video and share that with wound care specialists. We could also involve a psychiatrist to do a virtual assessment of Joe and provide treatment options. Unfortunately, this did not happen. Joe eventually passed away from sepsis due to a severely infected wound. We're at a critical time in pandemic response and recovery. It is an opportunity to introduce changes in healthcare delivery. Every time there's a patient with a wound, look beyond what you see. Understand their story, both medical and socioeconomic. We are at a pivotal time in medicine where digitizing the patient journey, involving the right members of our allied health teams at the right time, can ultimately decrease disease burden and improve patient outcomes, especially for patients like Joe.
Since starting in wound care over 10 years ago, I've been interested in having a device to measure wounds and document with consistency characteristics of the wound and treatment protocols. Knowing if the wound is getting smaller or defining characteristics that are valuable to understand why the wound is not healing is so important. I'm excited to have the opportunity to work with Health Espresso and Wounds Canada to develop this rich platform for use by clinicians, care providers, and most importantly, the patients. There are many factors that can place patients at risk for complex and non-healing wounds. As a primary care community physician and specialist in wound care, I appreciate the importance for early identification and treatment of wounds. To optimize the healing process, care needs to be timely. A structured approach to assessment, treatment, documentation, and communication based on best practice is necessary to provide patients with the best possible outcomes. Health Espresso, in partnership with Wounds Canada, has developed a tool to help clinicians and patients work through a best practice-based method for optimum outcomes and excellent experience for both. This tool provides an easy-to-use system to capture relevant details and track the healing trajectory. It includes a photo documentation function to capture detailed, accurate wound information such as size and healing progression over time, and has a patient at-home monitoring feature to track progress even without clinician input. Additional features of the tool include patient records to ensure consistency in documentation and provide historical context about each patient, wound, and other health concerns, making it a valuable tool regardless of the level of experience of the healthcare provider or familiarity with the patient. This will also facilitate an integrated information sharing with other members of the healthcare team to assist with management or indicate the need for an in-person visit to a physician or a multidisciplinary wound clinic. The just-in-time learning feature will provide access to Wounds Canada validated tools and resources. Clinicians will be able to link to specific information that can be immediately applied at the bedside. Patients at risk for or living with wounds will also have access to tools that support self-management. Remote patient monitoring is a key feature that will allow early identification of non-healing wounds by prompting the healthcare providers to adjust their care plans quickly to improve patient outcomes and save healthcare dollars.
On behalf of Health Espresso's team, we're excited for the opportunity to partner with Wounds Canada to bring skin and wound care best practices, resources, and training to frontline care practitioners at point of care. Inspired by our frontline experience in the home and community care sector, Health Espresso provides a digital platform to bring Wounds Canada's leading-edge wound care management, user-friendly tool for both nurses and patients that self-administer their own care. Our proprietary artificial intelligence enables a phone or a tablet to image capture a non-invasive wound measurement, automatically capturing the length and width of the surface area for analysis of wound type and progress. Images are simultaneously available from the point of care onto Health Espresso's in-cloud web portal for wound specialists to assess and track progress. One of Health Espresso's unique value propositions is that it provides a connected, collaborative approach to skin and wound care. Unlike many standalone solutions, Health Espresso integrates the wound imaging, analysis, and progress tracking into a digital patient profile, offering a broader scope of the patient's health, including real-time vitals data, administered medication, history, and other health information that may affect a clinician's decision on prescribed treatment that in turn can be tabulated on a digital care plan for in-progress evaluations and care continuum. Our built-in messaging and video tool is certified by Ontario Telehealth Network and allows physician-to-patient live communication in a secure environment for remote access for wound specialists to patients in outlying communities. The Health Espresso team is excited about our partnership with Wounds Canada, where we will in the future compile and provide the data necessary to fuel research and treatment for better outcomes.